I have the knowledge, skill, and judgment to complete a urinalysis from an indwelling catheter. I reviewed the physicians and facilities, protocols, and policies. So now I'm going to don my droplet contact PPE precautions. Start with hand hygiene. And I'm going to don my gown, making sure that it covers all the way to my knees, and my neck first, making sure it's overlapping. And then the back. Okay. And hygiene now I would apply my mask, but I'm already wearing my mask. And then my eyewear. And then I will apply my gloves. Making sure that the gown is tucked in. All right, then I will gather my supplies and bring it into the patient's room with me. I need clamps, my syringe, and my specimen container, and my alcohol pad. Okay. Oh, sorry. And my blue pad. So first, I'm going to set my equipment up on the table here. Hi, Mr. Savina. My name is Katrina. I'm going to be your nurse for today. I'm here to do a urine withdrawal so we can test it and better your care plan. Is that all right? Okay. So first what I need to do is I'm just going to double check. Can I please have your name and date of birth? Thank you. Provide privacy. I will raise the bed to my working height. Is this one able to raise? Up to my waist height. Okay. I will lower the side rail here, actually. I'm going to put this on this side with my equipment. So I'm going to need to expose your genital area. Is that all right? Okay. So first I will assess the area around the catheter, and then I will ensure that it's in the right spot, nothing is irritated, and all the tubing is not kinked, there's no leaks. Nope, all right, it's fine. Okay, so what I'm going to do now is I'm going to clamp the tubing for your catheter. I'm just going to collect some urine, and we're going to wait a bit, and then I'm going to come back and withdraw. Is that all right? Okay. So using my scissor clamps, I'm going to judge 10 to 20 centimeters away from the lure lock and clamp it. I will do so on alternating sides. does that feel? All right, and I will cover the patient, replace the bed rail, and I will give them their pulse monitor. I will exit the room, doff, and be back in 12 minutes, 10 to 15 minutes. Hi, Mr. Sumina, how are you feeling? Good? Okay, so it's time to withdraw that urine now. Okay, so I'm going to have to, again, expose your genital area. Is that all right? Okay. So what I'm going to do first is I'm going to place the blue pad in the area where I will be withdrawing the urine from, and make sure that my equipment is prepared. So I'm going to open my specimen container, ensuring that I'm not touching the underside as to not break sterility. My syringe is open, and I'm going to begin by cleaning the luer lock. Discard the garbage. For a good amount of time, ensuring the sterility to reduce the risk of infection. I'm trying not to touch the balloon port for the indwelling part of the catheter. Okay, and I'm not going to put the luer lock down as to not prevent infection. I'm going to allow it time to dry. I will remove the syringe from the packaging and place it onto the luer lock, press, and turn to ensure that it's attached. And then because I have a 20 milliliter syringe, I'm going to aspirate 20 milliliters of urine. All right, and I will remove this, discard the package, and immediately take off the clamps. Is everything feeling all right? Okay, and I will discard the clamps either in a basin to be reused or immediately in the sharps bin. I will not put down the syringe. Make sure that there's no kinks in the tubing and that everything's draining properly. Remove the blue pad, discard that in the waste, and cover up the patient again. And now we'll be placing the urine into the specimen container. So I'll remove the cap, place it upright, making sure that nothing is touching, and then depressing the plunger, expelling the urine into the specimen container, ensuring nothing touches the edge of the container. Go slowly enough not to splash, and that the tip of the syringe is in the container. All right, I will dispose of the syringe and replace the cap. Sure it's on tight. I will label it with the patient's name, their identification number, the date of birth, my credentials, the time and date it was taken, and where on the patient it was taken from. Replace the I'll lower the patient's bed. There we go. Down to the lowest setting, and I will exit the room. I will place, now I'm in the ante room, down my specimen, and I will doff my gloves first, going glove to glove. And then skin to skin. Dispose of the gloves, and I will remove hand hygiene. Then I will remove my gown, going neck and then abdomen section. So moving forward with my dominant hand, I'm going to slide under my sleeve and roll. And then the other arm, do the same. And then roll off, containing the exterior of the gown in the ball, and immediately dispose of the gown. Now, out of either in the ante room or out of the room, I will just do hand hygiene again. And doff the eyewear. And then I would doff my mask directly into the wastebasket. And I will take the specimen to the lab, and then I'm done.